eye specialist, etc. So you have to concentrate on this dhatu kshaya, which is definitely going to take place in long run and which will give rise to loss of vision, visual field defect. Okay. So you, as madam also has highlighted about the prevalence, so it is going on increasing day by day. Next, after cataract, this is the glaucoma itself is the cause for blindness. So that is why we have to take care of this. We have to give more importance by organizing such awareness programs in the form of camps or CME, wherein we have to make the general public also aware. They have to come for regular eye checkups, because always I see patients, they come only they have any problem. But now you have to give awareness lectures to all your family members and all your patients in future when you become doctors, that you after 40 years you have to go to a eye specialist and you have to check the pressure and you have to go for optic nerve evaluations. In long run we may be diagnosed as glaucoma, and then you can, if you start the treatment, then it will be lost to the patient. So that is why you have to be very important to do this awareness program for the general public. And when it comes to the target where there is IOP, is either it is increased or it is decreased. I mean, there will some obstruction in the drainage of the aqueous, or there is any over secretion of the aqueous. So this also is an area where you have to concentrate. So what are the techniques? What you can do here? So as madam was saying that the ballooning of the iris will be there. So that affect how we can reduce it from Ayurveda point of view. So you see that acharyas, when they have given the treatment for this glaucoma, we will all be very surprised. They have told this Sira Vedana karma is one of the top priority which is given for this disease. So how it acts, Vedana karma, it will drain out the excess of fluid or the aqueous, etc., and it will maintain the or either obstruction. It will clear the obstruction and it will excess production also. It can be looked after by this Vedan karma, because it has many beneficial effects. And Siravedan can be done in many forms. You all know that we can go for Siravedan by using the Jaloka. So Jaloka is also a very important procedure. So you see Jaloka not only sucks the blood, but the hirudin content in Jaloka is a very good anticoagulant, and it will also clear the Srota Varoda. So this is a very important technique which we can adopt in glaucoma, because this is the primary line of treatment. So that we have to adopt. Next, when the patient comes with the symptom of pain and he will have increased IOP, how we can manage in Ayurveda perspectives? That is by using very simple medication. That is, you can go for simple procedures like this parishek, netra parishek and pindi, and also use of osteoton. So we have so many drugs which are having Chothar action, like Punarnavadi Quad, we have Gopchuradi Gugul. We can give internally also, and we can also use it as topical in the form of this netra parishek. And also osteoton. So the shigru also is very wonderful drug. So all these drugs, whatever is mentioned for abhishan, the same has been repeated here. And again, depending upon the type of abhishan, you have to select the particular drug. So if it is Kaphaja abhishan, you have to use Kaphaja dravyas. So either it may be Lodra or Shigru or Punarnama, all these drugs should be used. If it is a Pitta or acute condition, then you have to use Pitta Shamak dravyas. So here already there will be congestion, as you have seen the photo. So there will already be congestion. Congestion can be managed with the Pitta Shamak dravyas. You can use Manjishta, Lodra, HT, etc. Kasheruka. All these drugs are Pitta Shamak. So in this way, your management also should be focused on the doshas and on the symptoms, and also on the type of glaucoma. Okay. So here you can also go for Pindi. So how Pindi acts, I will tell you. So you see that when you keep something on the, you put pressure on the cornea. So when you use a Pindi, there is some amount of pressure on the cornea. So when the cornea is compressed, then this pressure is also transferred laterally. So that laterally, especially at the Schlemm's canal. So this will open up the any obstruction at that level. That is, when you open up these channels, then the aqueous, aqueous, whatever is there, is easily drained out. And also there will be some pressure on the this iris also. So that will also because the ballooning of the iris, as madam was saying, that also will be compressed, and in that way the excess this thing IOP or this, aqueous will be drained out. So that is a very easy technique, and you have clinically also you can see in patients. You can take this pressure before the pindi and after the pindi and you measure it. Definitely the pain also reduces and the pressure also reduces, because we do it for many patients. So these are the simple techniques which you can adopt. Okay. Next, I told you this aqueous outflow or any obstruction that can be managed with the Siraveda, and then you can manage with the Pindi, Vidalak also will help, and Aschotan as well as the Parishik. So here nowhere you are going to start the other treatments, other line of treatments, because in acute stage when there is Amavastha you cannot start the other procedures, high-end procedures which are directed towards improvement of the vision. Okay. So in this way, this is the conventional, the madam has already explained how the ciliary body is, this aqueous is secreted from the ciliary body, then it comes to posterior, then anterior chamber, and in that way you see the sequence. So I have already explained how you can put your Ayurvedic treatment principles in this, like pathology. Okay. Then we have already the same thing is there. Next, what we have to concentrate is congenital glaucoma. We cannot do much because already there may be some damage, so that has to be taken care of. But you can, if there is a diagnosed case of congenital glaucoma, then you can start early intervention. Here you have to do dhatu kshaya, you have to take care of the neuroprotective drugs you can use, and you have to take care of the optic neuropathy. So nadi balyahara aushadhis can be implemented at this stage. Okay. And in the primary open angle glaucoma, this is your field where you can actually give very good Ayurvedic treatment, because when there is acute case, even we cannot do much. We can do these procedures what I told you, but when there is lot of inflammation, then we cannot go for Tarpan, Puttapak, which are aimed to correct the vision. So, but you can manage the patient, give him some relief. So you see, in case of very painful eye, when you don't get any relief with all these procedures, what is the treatment which is mentioned? It is Agnikarm. So Agnikarm is also a very important procedure we can practice in case of absolute glaucoma. The patient has severe painful eye. Even in case of acute glaucoma, you can go for, because I have many patients who come to our OPD, his pressure also will be very high and the eye will be very painful even though there is no vision. So that time you can go for Siravir and Agnikarma Chikitsa. Immediately after you put Agnikarma to the Shiro Lalata Pradesha, you can use this area and you give Agnikarma shots for 1 second. And immediately after the treatment you see that the patient's pain will come down. So there will be drastic change. So I have done to many patients before and after. I will evaluate, and the pain usually it will come down after the Agnikarma. So it will hardly take a few minutes for you, and you need a Agnikarma Shalaka, and you can do this therapy. Okay. So in this way, for absolute glaucoma, this Agnikarma is one of the best therapy, because already patient has lost his vision, but we can give pain. I had a patient who came from some very long back. This patient had severe pain, and she was using so many drops, so many medications. Then too the pain was not coming. But believe me or not, with first sitting of Agnikarma, she got 50% relief, and in another 2 sittings the pain totally came down. So this type of treatment if you do, definitely then and there you can do Agnikarma whenever the pain arises. But usually after 1 or 2 sittings, the patients never came back for this pain management. So Ayurveda is very good for this pain management, and we also need to have all the latest diagnostic tools wherein we have to diagnose the glaucoma. So it is very important to keep all these tools, as Madam also has mentioned. Okay. So in this way, Ayurveda, it is treatments are very beneficial. So you have to know what type of glaucoma it is: Vataja, Pittaja, Kaphaja, and Raktaj. So here Vataja Adhimantha will have severe pain, and the symptoms are it can be correlated to angle closure glaucoma. So severe Manthanivat Vedana, Aranivat Vedana. So the Vedana is the main feature, and this Vataj this Adhimantha, if it is not treated in time, it will give rise to Adhimantha. That is the advanced stage. So that is what we call absolute glaucoma. So in absolute glaucoma, the patient will not have much vision, or he may be even light perception also will not be there in some patients, but the pain will be very severe. So Hatadimant, so that is the stage. In Hatadimant also we have two stages. So initially the patient's eye will become very hard because of the excess pressure. Then you can see optic atrophy and all the other changes will be there. Apart from that, this patient, like after some stage, there will be shosha. That is, the whole eye will be sinking. That is, you can see that phthisis stage also will occur, and these two stages are also mentioned by our acharyas. So it is you can see the gravity of our and intelligence of our ancient acharyas, wherein they have mentioned all this, and just we have to analyze what are in what way we can understand this. Okay. And in Pittaj and Kaphaja, you see acute symptoms, primary angle closure glaucoma, there will be acute symptoms, the redness, etc. So wherever you find, so whenever there is painful symptoms, then you can treat it as Vataj Adhimantha. When you have more of this congestion and other symptoms, so you have to, when Arishtavat, the eye looks as if it is like soaked in, Arishtavat Lakshanas will be there. That is that time what you have to do is you have to manage it based on Pittaja and Raktaja line of treatment. So the drugs also totally differ. So you cannot stick on that in Adhimantha I am going to use this. So if it is depending upon the symptoms you have to diagnose. So it is whenever there is Raktaja and Pittaja Lakshanas, then you have to give only those drugs which are particularly mentioned. So you cannot give Vata. In Vatahara mainly it is given to pacify the pain. Okay. Pain will be acute. And in the case of Kaphaja Adhimantha, so that is there will be mild headache and there will be more of obstructive symptoms. And madam also mentioned that nasal obstruction. You see, our acharyas have mentioned Nasa as a cause for Kaphaja in case of a symptom in case of Kaphaja Adhimantha. Really, we have to be surprised. So this nasal blockage will cause hypoxia in the brain. So this hypoxia will not only limit it to the brain, it will be also affecting the retinal nerve fibers, that is the ganglion cell fibers, and till what time the patient has nasal obstruction, he will, till that time that ganglion, there will be hypoxia in these fibers, and thereby there will be death of this ganglion cells. So once the nerve cells are dead, they cannot regenerate. This is also a theory which is given by the modern people, but still this theory will change, I know, because once the nerve is damaged, they say that it cannot be regenerated. But we see that even many patients of optic atrophy, those who are PL positive, in such cases slowly there will be improvement in vision. There will be, the vision can be it will come to hand moment, and then slowly we can gradually we can improve the vision. We have seen many patients coming to our OPD because this center, you should be very lucky with the number of patients who come here. And now when they know that there is no treatment in modern science, when they have all the latest investigations, everything they are doing, but this area is a dry area, like the ganglion cell death which is taking place gradually in glaucoma. In long run, there is no cure for that, and here we have to go for dhatuk, prevent the dhatuk shaya. So dhatuk shaya at this level, how we can prevent? By giving chakshushya, rasayana dravyas, then also we can use nadi balya dravyas, optic nerve. This neuropathy can be prevented and managed well if we start this medications early in a patient of glaucoma. Okay. So that is how you have to fit into the therapy. So whenever the acute symptoms are there, don't go for this tarpan and puttapa and also anjan. So you can start with the usually that's why in OPD we should not take risk. First, whatever our classics or acharyas have told, that we have to stick on. So first we have to do mrudu samshodhan. So for that you can give some triphala kashaya or triphala churn or any type of Taruni Kusumakar or Panchashakar, any of this can be given as a Mrudu Samshodhan. because patient, you know, if you put him on Sharira Shamshodan in a long, like going for Snehapana and all, there will be lack of time. Like in some cases we can do, but patient's time is very precious, because when we are doing Snehapan, we cannot do other procedures. So in that way, you have to also think about the giving this thing. Best treatment in the limited time. That is also very important. Otherwise, patients will get the feeling that Ayurvedic treatments are very long standing and they will not get will not get the relief. So that should not happen. You can plan that Sharira Samshodan in next stages. But right now you have to show some relief to the patient, and you can start with Nasya. Here again for Shira Shodhan, you have to go for Nasya. So again, depending upon the type of glaucoma you plan. If it is Vatajanyan, then you can use Navana type of Nasya. You can use any Vratahara Dravya like Shirabala 101. If it is Kaphaja, then definitely you have to go with Kaphagna Dravyas. Shigru Taila is there, or Shigru, you can go for Avapidan also, Punarnava Shigru, or any drugs you can select. And Pitta and Raktaj cases, usually such cases will not come to us, but when there is acute inflammation, then redness, congestion, etc., then you can go for this Pitta Shamak Dravyas. You can go for Aschotan, Parishek, and Nasya also if you are doing. It should be Eshti Taila or any of this Pittahara Dravyas. That is very important. And next, what you have to do is, after the Amalakshanas have subsided, minimum at least 3 days you can do. After that, you can go for other procedures like Anjan, then Tarpan. Usually we will start with the Tarpan at this stage. And Tarpan usually you can do maximum, because it is a Vatahara condition. 1000 Matra Kalas can be given to the patient, and also can be given for a maximum number of days, that is 7 days. We can give Tarpan, and then after Tarpan, you have to plan for this add-on therapy, that is Puttapak, which is very important, because in Tarpan we cannot gain those concentrations what we can achieve in case of Puttapak, because Puttapak, it is even more finely processed. So it has meat also, or it has liver also. Liver also you can use if you want a Lekhana effect. And also you have Rasaushidhis in the form of bhasmas, and like Loha bhasma you can use if it is case of Lekhana Puttapak. Tamra bhasma you can use. If it is like Snehana, then you can use like Shita Vidya action you need in case of Pittaj and Raktaj. You can use this Shankha Bhasma, Pravala Bhasma, Vaidurya Bhasma. All this can be added. Okay, and then you can also mix the Sneha also. So in this way, it is a blend of herbo, mineral, dry drugs, wet drugs, then animal origin, that is in the form of liver or meat, etc. And you are going to take that extract, which is in the form of very minute particles. You can say nano particles, which will act as a prodrug, and it will carry your this drug into the it will nourish, mainly it will nourish the ganglion cell, which will, that is the ganglion cell death which is going to occur, that will be arrested by giving this Tarpan and Puttapak, because it will have maximum concentration of the drug will enter. And even though while doing this procedure also we pack the eye. That is to give rest, complete rest to the eye. Otherwise, the photoreceptors will be stimulated if it is exposed to the light. That is why usually I ask my students to cover it with the leaves. That will give more soothing effect to the eye. So that is also very important. When you relax the patient, even his mind will be relaxed. Maximum absorption takes place. So my patient should be fully relaxed, so that he can get the maximum benefit of this treatment. And after that you are going to give Puttapak. So in Puttapak, two goals will be achieved. One is to remove the excess of Sneha, and the other is also to, because it is a herbo-mineral drug, it will have maximum ionization of particles. So these ionized particles which are released into the Puttapak cellular content will also will be like it will carry the drug to a much higher level, that is the ganglion cell layer, the optic pathway, etc. So in this way the whole optic pathway will be nourished, and even in Nasya to some extent this optic nerve will be nourished. So in this way you have to plan your treatment. So I hope you have understood, and we are doing all the procedures as you have seen, and you can visit our OPD and many of the students are also participating in making puttapak. So you should know how to make the puttapak because that is very important. Many centers they don't do all these procedures, but you people are very lucky that we are doing here, and maximum you can get the benefit. Okay. So these are the procedures how you can adopt. So I hope all of you have got a little this thing about glaucoma, and I'm sure that you will take home some points on glaucoma, that is early diagnosis, early screening, early intervention with Ayurvedic chakshusha dravyas. So you can anyone of you name chakshusha dravyas which we have in Ayurveda? One is Samtamrut. Next.
Trifla.
How many sign we have? Then come on. We have ashwagandha. Ashwagandha is one of the best neuroprotective. You can use ashwagandha. You can start ashwagandha at an early stage. So here you need neuroprotection. So you have to prevent the ganglion cell death. So and also you have to reactive oxygen species will also be released into the bloodstream. That will also give rise to many complications. So in order to use that, we have to use antioxidants. Antioxidants will reduce the formation of this reactive oxygen species. So this will be in the form of HT. We can use HT, we can use shatavari, then we can use bhasmas, bhasma, etc. So in this way you can select. Guruchi is also one of the best drugs which is having this antioxidant effect. And also for Shotahara drugs, definitely you have so many drugs, Punarnava, Quath, Gokshuradi, Bugul, that also you can use for in long run, that will also control the Shotha, that will also take care of some obstruction which is taking place. And at the same time, as soon as the patient is diagnosed with glaucoma, you start this Ayurvedic medications. Then definitely we can prevent the optic atrophy, because that is the main concern of the patient. You can manage the prejudice somehow, but this optic atrophy will give rise to problem to the patient. Thank you for patiently listening to my lecture.
Thank you so much, ma'am. It was very wonderful lecture on Ayurvedic aspects of glaucoma. Now I'd like to request our guest speaker, Professor Chitra ma'am and Associate Professor Aparna Sharma ma'am, to felicitate our